I'm speaking today in my capacity as the CEO of Anthrologica, but also drawing on the work that Anthrologica contributes to the Social Science and Humanitarian Action Platform, or as that platform is commonly known, SHAP. Anthrologica is a research organisation. We primarily work with applied anthropology and other social sciences in global health. And I'm going to talk about our work and our perspectives on engaging with communities in the arena of responding to disease outbreaks and epidemics. So with regards to SHAP that I just mentioned, Anthrologica are a founding partner of SHAP, and that platform works on explaining social dimensions of emergency responses. So engaging with communities is therefore, of course, a core part of that work as well. I'd be inclined to turn the question upside down a little bit by asking how can we ensure that all crisis response partners understand its relevance? Because I think now in 2022, a great many of us who are working internationally in the humanitarian sector clearly understand how important it is to ensure that crisis response is centered around the identified needs of communities. We've got effective ways of understanding those needs and often are engaging in a meaningful and relevant way. But when we look at specific crisis responses, and here I'm referring really to responses to disease outbreaks, but as I said, I think it applies beyond that. We know that there are real difficulties in making sure that the perspectives of communities are properly incorporated into response actions, and that people, communities, and so on feel their concerns and their insights are listened to. So to some extent, we're failing to learn lessons from previous outbreaks. We see there's an Ebola outbreak in East Africa, as well as multiple cholera outbreaks in the region. And what we've observed is that while there are good mechanisms for gathering information, the response mechanisms themselves did not or are not managing to use this information well or engage with the communities and the other affected groups. So it depends on how you define a community. So you can say that health workers themselves are a community. So we're not managing to engage effectively with those communities from the start of those outbreaks. And one of the common responses to this is, or common reasons for this is just that the national response structures aren't necessarily set up in such a way that information collected through, for example, social science research are integrated across the various pillars of the response. And many of those pillars should have an element of community engagement within them. So it's something that we really need to promote and to really think, is the information and the feedback that we are receiving as let's say, operational partners, is it being used to make engagement through response pillars better and make a better response and therefore better outcomes? So the ways in which we engage with affected communities is something that shouldn't just stand alone, and collaboration with partners across the whole response is essential. If we stay with the example to responding to disease outbreaks, it's normally quite clear who the collaborators are for a given context or a given disease, but it's actually the role of those national structures that I mentioned, so government ministries, task forces, and so on, to coordinate those collaborators. So for the international community, and particularly for the UN agencies and other major actors like that, I think the question for us and for those actors is not so much who are the collaborators, but how should we collaborate? And so we still see far too often that there's poor transparency of what different agencies are doing. And there can be this kind of protective or competitive or even secretive atmosphere, which is just wholly unhelpful when fast action is required in the face of an infectious disease or some other crisis. So I'd love to see partners be open about the work they're doing and the work that they're commissioning and who they're working with and how and what they're trying to get from it and how they're going to contribute to a whole. And if partners are actively engaging with communities, that they should approach or make themselves visible to nationally led structures to offer those contributions through a nationally integrated response plan. There are really excellent examples of how this can happen and how engagement with communities can contribute effectively. And that stuff's documented about how it can be central to a crisis response. I feel that sometimes the debates about engaging community and ensuring our work and our programs are actually accountable to the populations, all the populations affected by a crisis, feels a little bit like lip service to the issue rather than real meaningful action. I don't mean that to be critical. It's a really easy trap to fall into, but our motivations to engage in a meaningful way, they may be well placed, but we get truly tangled up in jargon. So there's a plethora of terms and acronyms like CCEA, RCCE, C for D, CWW, which in their acronym form are essentially jargon, but they distract us from the core of the work. So I think it's useful for partners to agree to try and keep things simpler and to commit to some of the core principles of these concepts.